Good afternoon, everyone. Thank you for joining me today for the CACFP At-Risk After School 101 webinar. Since this training is an annual requirement, you will be required to take a short quiz after this presentation as proof of participation. My name is Alyssa Mank, and I am a CACFP nutrition consultant for the Department of Education. If you have any questions after reviewing this training, please contact me at the email address on your screen. Let's get started. First, I will be discussing the legislation that was passed in 2019 called LD 577. If this legislation does not apply to your district or your district is an experienced CACFP sponsor, you may skip ahead in this presentation to a slide titled CACFP Meal Pattern. LD 577 is titled An Act to Increase Access to Nutritious Foods in Schools by Implementing an After-School Food Program for At-Risk Students. The public law is available to view online at the link on your screen. LD 577 states beginning with the 2020 school year, a school administrative unit with at least one public school in which at least 50% of the students qualified for free or reduced price lunch during the preceding school year shall participate in the federal child and adult care food program. So how do I know if my school district meets the 50% or more criteria? In anticipation of this question, DOE Child Nutrition annually creates a report titled LD 577 District Status Report. This report shows all the schools and districts that fall under the requirements of LD 577. The LD 570 status report is located on the CACFP At-Risk webpage. The link to the At-Risk webpage is available on your screen. It is important to note that the image of the report on your screen is an old example of the report and it is not current. Please check the full report to see if any of your district schools are listed. So what do we need to serve for CACFP At-Risk After School? The typical meals are for snack, 2 components, same meal pattern and reimbursement rate as the National School Lunch After School Snack Program. And supper, which is 5 components. It can be in unitized containers or served through a normal lunch line. It can be hot or cold. It's a great way to use unserved items from lunch. Schools can use offer versus serve, offer 5 components, and a student must take at least 3. And it's $3.75 for each supper meal served. That's $3.51 plus 24 cents cash in lieu of commodities. Please note that this training is being conducted in June and reimbursement rates are updated every July. Please reach out to me by email if you have any questions about the current reimbursement rates. Districts who operate CACFP at risk can serve on snow days, school vacations, and weekends. Districts can even serve breakfast and lunch on those days with prior approval. It is important to know that snack or supper can be served as soon as the school day ends. An example is ABC School dismissal bell rings at 2:30 p.m. ABC School can serve supper at 2:30 p.m. A requirement of the program is participants need to eat their meal on site. I will be discussing any waivers currently in place at the end of this presentation. So if my district meets the requirements of the law for CACFP at risk after school, but our district is already serving snacks through the after school snack service program, do we need to do anything? And the answer is yes. The district needs to either participate in the CACFP at risk after school program or opt out using the guidance from LD 577. Our district or school does not offer an after-school enrichment activity. What are we required to do? An after-school education enrichment activity that is open to all is a requirement to participate in CACFP at risk after school. If a district or school does not provide education or enrichment activities, the district or school does not qualify for CACFP at risk and must opt out using the guidance from LD 577 or start an enrichment program. So what does open to all mean? Education or enrichment activities that do not limit membership for reasons other than space, security, or where applicable, licensing requirements. So this means the football team, the basketball team, or any sports teams would not qualify as enrichment because it's not open to everyone every day. Examples to open to all enrichment activities are homework help, garden club, Lego club, etc. So how does my district opt out? By law, a school administrative unit that is required to operate a federal child and adult care food program may choose not to operate such a program if it determines by a vote of the governing body of the school administrative unit after notice and a public hearing that operating such a program would be financially or logistically impracticable. This could be a school board meeting which allows a public hearing prior to the vote. After our district holds the public hearing and the board votes, do I need to report the results to the Department of Education? Yes, an online LD 577 opt-out form is created annually. This form requires information regarding the date of the notice, the date of the public hearing, and the date of the and results of the school board vote. The form also asks why the sponsor or district decided not to operate the CACFP at Risk program. Under LD 577, when do schools have to have their public hearing by? Is there a deadline or a timeline? Child Nutrition annually posts a list of qualifying schools that fall under LD 577 that school year. The notice, public hearing, and the school board vote needs to be completed sometime within that qualifying school year. So to recap, the qualifying district can start or opt out anytime during the qualifying school year. So a district that may want to pilot the CACFP at Risk program and serve supper may want to start the program in the spring. Try it out for a few months and see how it goes. So what is the process for starting the program? First, reach out to Child Nutrition via the Child Nutrition email and let us know that your district is interested in participating in the program. Secondly, watch the CACFP at Risk webinar, which you're doing today. So yay, you can cross that off your list. The third is to send the CACFP team the required information to be set up in CNP Web. Once you reach out to us, we'll send you an email with all the required information that we need to have to set you up into the system. Once we do that, you will obtain your user ID and password from us. You will go in and you'll complete the CACFP online agreement in CNP Web. And number 6, your agreement will be approved. The district may claim meals from the beginning of the month in which the agreement is approved. The agreement approval process time can be varied based on the number of corrections needed once it's been submitted to the state agency. The CACFP team is great about processing agreements as quickly as possible. If you have questions about what you just heard or need more clarification, we recognize each district and school is unique, so please reach out to us. We want to help. Now we are going to dig into the basics about CACFP at Risk. Please know all CACFP training documents are located on the webpage or by using the link on your screen. All CACFP at Risk training materials are sent out annually when your agreement is approved or upon completion of the agreement renewal. First, we're going to talk about the CACFP meal pattern. At-risk programs can operate outside regular school hours. This includes holidays, vacations, snow days. At-risk sites can serve up to 1 meal and 1 snack per child per day. So an example is ABC School serves breakfast and AM snack during school vacations, as long as they are meeting that required enrichment piece. This is the CACFP meal pattern. It's important to know that you would serve participants between the ages of 13 and 18 the same serving sizes as the 6 to 12 age group. These are minimum serving sizes. We certainly encourage your districts to serve more to the older kids as they probably need more. So like I said earlier, breakfast may be served on school vacations, weekends, and holidays if the education enrichment activity is offered. The breakfast meal pattern for kids is made up of 3 food components. The first is fluid milk. The second is a fruit or a fruit or a vegetable or a combination of both. At breakfast, fruits and veggies are treated as a single component. So for breakfast, providers can choose to serve a vegetable, a fruit, or a combination of both. And the third component is a grain. If you wish at breakfast time, you may replace the grain component with a meat or meat alternate item up to 3 times per week. This handout is available on our webpage and can provide you with more tips and information about replacing the grain with a meat or meat alternate item at breakfast. It's an important thing to remember that there are no vegetable subgroup requirements in the CACFP meal pattern. USDA has a great handout regarding serving milk in the CACFP. It has a lot of great information and is a quick guide for serving milk to all ages in CACFP. On the back, it gives you space to practice identifying the correct milk for the different age groups. Under Nationwide Waiver number 91, child and adult care providers are permitted to request a waiver to offer low-fat, 1% flavored milk. So what age group does this apply to? This waiver applies to children 6 years of age and older. Child and adult care providers that request and receive state approval to use this waiver may serve low-fat, 1% flavored milk to children 6 years of age and older. Very similar to NSLP, CACFP sites must provide reasonable modifications to meals and snacks or to the meal service itself to accommodate participants with disabilities. These modifications are done on a case-by-case basis. If the meal modification required does not meet the meal pattern requirements, then a medical statement from a licensed physician or a licensed healthcare professional who is authorized to write medical prescriptions under state law must be provided. Meals that do not meet the CACFP meal pattern requirements are not eligible for reimbursement unless they are supported by a medical statement. The medical statement should include a description of the child's disability so that you understand how it restricts the child's diet. The statement should also describe what must be done to accommodate the disability. This may include what food should not be served and recommendations for what should be served. A medical statement is required to justify reimbursement for the modified meal. This statement should be kept on file at the site or where the food is prepared. If the parent provides a note, it must be signed by a doctor. Then you must, if the parent provides a note signed by a doctor, then you must provide the substitution. You may always choose to accommodate a non-disability related special dietary need that is not supported by a medical statement if the modification requested can be made within the meal pattern requirements. An example of this would be if a parent told you that their child cannot eat strawberries. Strawberries can be easily replaced by another fruit to meet the meal pattern requirements. Modified meals that meet the meal pattern requirements are reimbursable without a written medical statement. However, you should have a note from the parent on file so that we know why the child is receiving something different from everyone else and that there is no appearance of any discrimination. Non-dairy beverages may be served to participants with medical or other special dietary needs. Non-dairy products that do not meet eligibility requirements may only be claimed if there is a documented disability and the product is specifically listed on the diet modification form, which is signed by a medical authority. Non-dairy beverages must be nutritionally equivalent to cow's milk and meet the nutritional standards listed in the manual. Non-dairy beverages may be any fat level and must be unflavored for children under 6 years of age. As you'll remember, fluid milk is its own component in CACFP. So if you cannot serve fluid cow's milk, then you need to either find a beverage that's nutritionally equivalent to cow's milk, or you need a note from the doctor if you want to receive reimbursement. The following milk substitutes do not require a diet modification form: lactose-reduced milk and non-dairy beverages that are nutritionally equivalent to cow's milk. And we have a list on our webpage of some that we have in the state of Maine that are nutritionally equivalent to cow's milk. Remember, if the parent or guardian has a doctor's note, then you must provide the food substitute. However, you may run into a situation where a parent or guardian requests a substitute, but the child does not have a disability and they do not have a note from a doctor. It's definitely great customer service to provide the requested substitute if at all possible. If not, remember that parents can still bring in one food component and you can still claim the meal if you provide all of the other food. Regardless of whether you're providing the substitute or parents are, have the parents fill out the diet modification form and keep it on file to prevent any appearance of discrimination. The meal containing the substitute will be reimbursable if the substitute is nutritionally equivalent to the original component and meets the meal pattern requirements, and the diet modification form is on file. For example, a family may be vegetarian and want their child to receive a non-dairy beverage. It would be great customer service to purchase the non-dairy beverage if you can. Have the family fill out the diet modification form to request their child receive a non-dairy beverage. Then refer to the list of milk substitutes that I mentioned earlier that's on our website. If the non-dairy beverage that they are requested is listed on the chart, it is nutritionally equivalent to cow's milk. So it meets the meal pattern requirements, and you can serve it and receive reimbursement with just the parent note on file. If the parents insist on a non-dairy beverage that is not listed on the form that we have on our webpage, that is not nutritionally equivalent to cow's milk, and you cannot receive reimbursement for meals and snacks containing the substitute until you get a note from a doctor. So limiting juice to once per day helps increase fruit and vegetable consumption. 100% juice or vegetable juice is creditable in the CACFP as either a fruit or a vegetable, depending on what it's made of, but you are only allowed to serve juice one time per day. This is due to juice lacking dietary fiber and other nutrients. Vegetables and fruits that are blended and served as a smoothie are considered to be juice and are included in the restriction of juice being served no more than once each day. The once per day restriction applies to the center, not to the individual child, so juice cannot be served at PM snack and supper, even if the snack and supper are being served to two distinctly different groups of children. If juice is being served at two different supper shifts to two distinctly different groups of children, it can be served to both shifts because only one meal service contains juice. The meal pattern for kids for lunch and supper is made up of all 5 food components. Unlike breakfast, fruits and vegetables are considered different food components at lunch. There are a few rules around serving fruits and veggies at meal times. Pureed fruits and vegetables used as part of a meal item, an example is pureed carrots in a sauce used for macaroni and cheese, can count as a creditable vegetable as long as the dish also contains at least an eighth of a cup of a recognizable vegetable per serving. 2 servings of different beans or peas, which are legumes, can count as a vegetable and as a meat alternate if in the same day if they are in separate dishes. For example, chickpeas may be served as part of a salad as a vegetable component, and pinto beans may be served as part of a chili as the meat alternate component. A full serving of legumes included in each dish must be served to each child in order to claim both a vegetable and a meat alternate component. At lunch and supper, you have the flexibility to replace the fruit component with a second vegetable if it's a different vegetable from the one you're already going to serve. This is because most children already eat enough fruit. Allowing 2 vegetables at lunch and supper increases exposure to a wider variety of vegetables. Vegetables do credit towards the meal pattern based on volume. Kind of the opposite of dried fruit. Raw leafy greens credit at half the volume. So for example, 1 cup of raw spinach leaves would credit as half of a cup of vegetables. And in the CACFP, we credit tomatoes and avocados as vegetables. So please keep that in mind when you plan your menus. Here's an example. The lunch and supper meal pattern for children 6 to 18 years of age requires minimum serving sizes of a half of a cup of serving of vegetable and a quarter cup of serving of fruit. Therefore, the serving size of the second vegetable served in place of the fruit component at lunch or supper for this age group must be at least a quarter of a cup. And remember to offer 2 different vegetables. If you offered a half a cup of cooked carrots and a quarter cup of raw baby carrots, then the meal would not meet the meal pattern and you would not be eligible to receive reimbursement for the meal. So in the example above, a lunch with a serving of red peppers and a serving of carrots, both of which are in the red and orange vegetable subgroup, would be allowable. Schools may not serve 2 fruits at lunch and supper. Food items that are a mix of vegetables and fruit, such as a carrot raisin salad, can credit towards both vegetable and fruit component at lunch and supper if each component is easily recognizable and each serving contains at least the minimum reimbursable serving size of 1/8 of a cup of carrots and 1/8 of a cup of raisins. A child in the 6 to 12 years of age group would need to receive 1/2 of a cup of carrots and 1/8 of a cup of raisins, which is a dried fruit, in a serving to have the carrot raisin salad credit as the entire vegetable and the entire fruit component. Now, you may have noticed that I said 1/8 of a cup of raisins rather than the 1/4 cup of fruit mentioned in the meal pattern. That's because dried fruit credits a little differently. Dried fruit credits as towards the meal pattern at twice the volume of fresh fruit. So a 1/4 cup of dried raisins credits as 1/2 of a cup of fruit. Another rule around serving fruits is that home canned fruits are not allowed due to the risk of botulism, but freezing your own fruit is okay. Just like the vegetable and fruit mixtures, serving 2 vegetables as part of a vegetable mixture can also credit towards the entire fruit and vegetable component if you can recognize each vegetable and each serving contains at least that minimum 1/8 of a cup serving size. Home canned vegetables are not allowed due to the risk of botulism, but like fruits, freezing your own vegetables is okay. If you buy pre-mixed vegetable mixtures like the one on your screen, they'll need to credit as a single vegetable because you don't know how much of each vegetable is actually in the mixture. At snack time, you can serve any 2 of the 5 components as long as only one of the components is a beverage. It is best practice to include a fruit or a vegetable as one of your snack components to encourage healthy eating. The grain components include foods like breads, cereals, crackers, rolls, muffins, and tortillas. Major things that you need to remember about grains include that most sweetened grains are not allowed in CACFP and that one grain item served each day must be whole grain rich. For CACFP, grains will start being measured in ounce equivalents starting October 1st, 2021. We have this great grain-based desserts handout on our webpage. It was created by USDA, and USDA also updated the Exhibit A grain requirements. 1 grain per day must be whole grain rich. On this slide is a resource created by the National CACFP Sponsors Association that we have available on our webpage. This handout shows you how to correctly identify a whole grain rich food item using the rule of 3 and other methods. If you plan to serve only 1 meal or snack per day in your program, the grain served at that meal or snack must be whole grain rich. You are required to post a menu for parents to see the wonderful food that you're serving. Part of this requirement is that you identify which daily item is whole grain or whole grain rich. You cannot just write a statement on the menu that says 1 grain per day is whole grain rich or whole grain rich, You need to identify specific items with the words whole grain or the letters WG or WGR. Here's an example of Portland Public Schools Super Snack menu. And you can see on the menu that she wrote whole grain flatbread, whole grain granola. Sometimes we see this as a finding when we're out on review, so it's just a good reminder that chips and veggie straws are not creditable items in the food program. Breakfast cereals served must contain no more than 6 grams of sugar per dry ounce. Breakfast cereals include ready-to-eat cereals and instant and hot cereals. So how do I determine if a breakfast cereal is within the sugar limit? You can use the Maine Special Supplemental Nutrition Program for Women, Infants, and Children's, also known as WICS, approved breakfast cereal list. Anything on the WIC list meets the sugar limits. You can use USDA's Team Nutrition Training Worksheet. This compares your nutrition label to a table on the worksheet, and it helps you determine whether or not the cereal is within the sugar limits. Similarly, you can use the nutrition facts label on the breakfast cereal packaging to calculate the sugar content per dry ounce, and this worksheet helps you do the math. As I said earlier, CACFP meal pattern includes a flexibility to serve meat or meat alternates in a reimbursable breakfast. Schools may substitute the entire grains component with a meat or meat alternate at breakfast a maximum of 3 times per week. Yogurt must contain no more than 23 grams of sugar per 6 ounces. So how do I determine if my yogurt is within the sugar limit? Again, USDA has created some great resources. This worksheet, again, compares the nutrition facts label to a table, and it lets you know whether or not your yogurt meets the sugar limits. And secondly, they created another worksheet where you can take the nutrition facts label, and this worksheet helps you do the math to determine whether or not your yogurt meets the sugar limits. You can help offer versus serve is allowed at-risk sites. All the required meal components must be offered to each child, and each participant may decline to take one or two of the meal components, depending on the meal being served. Offer versus serve is not allowed at snack. Offer versus serve can help to reduce waste, but it's not appropriate for young children because they need to explore flavors and textures. Mixed component items containing 3 or more components may not be declined. A food component is one of the food groups that comprise a reimbursable meal. A food item is a specific food offered within a food component. So an example is turkey on a whole grain bread is a food item that contains 2 food components. Again, USDA has created this wonderful offer versus serve handout that is available on our webpage. There may be times when you want to serve a homemade or pre-made combination food or mixed dish. These are foods in which a single serving of the food item contains 2 or more of the required food components. Common examples of combination foods are pizza, shepherd's pie, chef salads, and a hamburger on a bun with lettuce and tomato. To document how these foods credit towards the meal pattern, keep either a standardized recipe or documentation from the food manufacturer on file. A See and Label statement clearly identifies the contribution of a product towards the meal pattern requirements. It protects the child nutrition program operators from exaggerated claims about a product. A See and Label provides a warranty against audit claims. If the See and Labeled product is used according to the manufacturer's directions during administrative review, the CACFP team will be asking to see copies of See and Labels for items listed on the menus. And in this example, it's a chicken stir-fry bowl, and the See and Label tells you that each 4.5 ounce of the chicken stir-fry bowl provides 1.5 ounce of meat, 1 ounce of grains, and a 1/4 cup of dark green vegetables, and a 1/4 cup of red orange vegetable, and 1/8 of a cup of other vegetable for the child nutrition meal pattern requirements. There are a couple of great resources available for helping you determine if and how a food item credit towards the meal pattern. One of these items is USDA's Food Buying Guide. The Food Buying Guide is available online and includes many different features to help you determine if items are creditable and help you determine how much food to buy. Another resource is USDA's newly updated crediting handbook for the CACFP. This is a great resource for learning about the meal pattern and determining if foods are creditable or not. Now I'm going to talk about record keeping in the CACFP. Record keeping is a very significant part of CACFP. Keeping accurate, complete CACFP records proves that you are eligible to receive this reimbursement. You'll hear us say a lot, if we can't see proof, we have to say it didn't happen. There are a lot of different types of records that you need to keep for CACFP. Today I'm going to cover what records you need to keep on file and where. Please try to keep your records well organized. It will save all of us time and energy when we review your program. You can keep your records digitally or on paper. Just be aware that if you do a review of your program remotely due to COVID-19, we'll ask you to email us program documentation. If we do any on-site reviews in the future, like we used to before COVID, we may ask you for the documents on paper. According to regulations, you must keep all CACFP records for 3 years plus the current year, so 4 years total. If your institution is going through an audit, certainly keep your records until the audit is closed. If your institution has a policy to keep them longer, of course, that is fine as well. The current and past year's documentation must be kept on site. The other 2 years can be kept off site if you don't have enough space to keep all 4 years on site. We give you all different records, forms, and information that you need for your daily CACFP operations. CACFP sends out CACFP at risk documentation once your agreement is approved or renewed. Most of the resources are also at the very top of the resources page of the DOE CACFP website so that you can access them anytime that you need them. If the forms that we created for daily operations do not work well for your particular program, you are welcome to create your own as long as they capture all of the needed information. It will be helpful if you organize the majority of your program paperwork by month. When we audit your program, we will request to see all of your program paperwork for a specific month of operation. So having it already organized by month will be really helpful. Familiarize yourself with your CNP Web Sponsor Agreement. It's a handy reference to ensure that you're claiming for reimbursement, what you're claiming for reimbursement is approved. It's a great reference to make sure you are claiming the correct number of sites and participants and the correct meals. Once you've completed your online agreement in CNP Web, most of the information will roll over into the following year. The district will be required to submit an agreement every year. Now I'm going to go through some of the specific record-keeping requirements for different CACFP records. The first is the non-discrimination statement. The non-discrimination statement is required on all program materials that are distributed to the public that mention USDA or CACFP specifically. USDA is very particular about the non-discrimination statement. You must use the exact wording of the statement and be very careful about the font size. There are two non-discrimination statements, the full one and a short one. This is the full non-discrimination statement. As you can see, it's pretty long and works well in bigger publications like a school handbook. This is the short statement. Prior approval for using the short statement is required for everything except menus. You can use the short statement on menus without permission. Remember, mentioning USDA or CACFP specifically versus saying we provide nutritious meals and snacks at no charge is an option. And I say this because if you are promoting your program, which you should, on social media or other types of platforms, you are required to post the non-discrimination statement if you mention USDA or CACFP specifically. So it may be in your best interest to just say we provide nutritious meals and snacks at no charge. There are different record-keeping requirements for different types of documentation. These are records that must be made available for public view. We will check them when we review your program. And these documents are a current dated menu, the And Justice for All poster, and the Building for the Future flyers. The And Justice for All poster and the Building for the Future poster are provided by DOE. As we mentioned earlier, all the menus must be posted in public view. The menu should be dated and labeled by site if needed. Since production records are not required for CACFP at risk, although a lot of schools still do them, menus must show all components offered each day. The menu must also show the whole grain item served each day. If there are substitutions, make sure the menu on file reflects the actual food offered. You are required to show what percentages of milk you are offering. This can be a generic statement specifying the types served. As a reminder, the non-discrimination statement must be on the menu if it is sent home with participants because it's a CACFP document. These are examples of unitized meals from Portland Public Schools. There's a chicken Caesar salad, a make-your-own pizza, and a cracker stacker. Portland uses a CACFP meal pattern as it's easily accommodated in the unitized containers. Stanford Public Schools has utilized their mascot to brand their supper meals as Spartan Super Snacks. They have created stickers that go on the unitized meal containers to show off their brand. Along with posting the menu in public view, the Spartan Super Snack menu is posted daily in the announcements. This is a great way to promote your program during the school day. Portland Public School delivers meals to the schools from their central kitchen in Cambro containers. Meals are delivered in Cambro containers to keep the meals at the correct temperatures. At-risk meal service is different for every school in every district. Some use carts, some use the normal lunch line. Find a way that works best for your students and your staff. The meal service can be in the cafeteria or served from a cart. The kids can eat in the cafeteria, the classroom, on the sports field, the library, anywhere on site. Under typical program rules, participants can only take one component off-site, which is one grain, a fruit, or a vegetable. The supper cart pictured is from a school district in LA, and I'll be covering any waivers that include eating off-site at the end of this presentation. In order to participate in CACFP, you are required to train your CACFP staff on 7 specific CACFP topics annually. Trainings that you or your staff receive outside of your organization do not count towards this requirement. You need to train your staff on exactly how to perform CACFP duties in your program, so outside trainings don't count. Some topics relate to all staff, some topics only relate to staff with relevant duties. You are required to keep documentation of these trainings. We can't just take your word for it. Again, you'll hear us say, if we can't see it, we have to say it didn't happen. We do have a form available to help you track staff training. It's in the list of forms that I mentioned earlier. The form lists all of the required training topics, and it has places to record the date and location of the training, as well as places for trainers and attendees to sign. Train on topics related to the staff members' CACFP duties. You don't need to train someone on how to take point of service meal counts if they only file the claim. We have a form available to help you track the training, which includes the required training topics. If you are working with an outside entity to provide the enrichment after school, and they are the individuals responsible for meal counts and attendance, they need training. It may be in the district's best interest to have site staff responsible for these duties sign a statement that they understand the training and the requirements of the CACFP program. There are 7 training topics that you must train your staff on annually. When we review your program, we'll ask to see your training documentation for all 7 of the required topics for all applicable staff. Civil rights is the first required training topic. Everyone having anything to do with CACFP needs civil rights training. We do have a civil rights presentation on our website that you can use for your in-house civil rights trainings, because civil rights procedures are the same for everyone. This is the only outside training that you can use for your in-house trainings. These are the other 6 required training topics: meal pattern, point of service meal counts, claim review and claim submission, reimbursement system, which is tracking CACFP funds, and record keeping. Please remember, I'm talking about in-house training, not trainings that you receive from us at the state or elsewhere. For each of these 6 topics, you will annually train your staff with related duties on how you meet these meal pattern requirements within your organization. You will train your staff on your organization's procedures for meeting this requirement. We can't help you with these trainings because we don't know how exactly you do things in your organization. For example, in some programs, point of service meal counts are taken by teachers. In other programs, the cook may be in charge of the point of service meal counts. Every program is a little bit different, so if you need to train your staff on your specific procedures. We touched on it briefly earlier, but it's imperative that you keep any doctor's notes or parental requests on file regarding food substitutions. If the food substitution results in you not meeting the meal pattern, you must have a doctor's note on file if you plan to claim your meal or snack. If it's a parental request and you can still meet the meal pattern with the food to be substituted, keeping those notes prevents any appearance of discrimination if a child is not eating the same food as everyone else. We will ask about these notes when we review your program. You also need to keep point of service meal count records. Point of service means that you're taking these counts of the meals served immediately before, during, or immediately after the meal service. Most CACFP programs require meal counts to be taken per child at point of service. Some programs have a sheet of paper with a list of kids' names and columns for each meal and snack, and they make a check mark next to each child's name when they're served each meal or snack. We included a sample meal count form on our webpage that I mentioned earlier. You're welcome to use this meal count form, or you can create your own, as long as it captures all the information needed. Some businesses purchase computer software that captures their meal counts. Either method is acceptable. At-risk after-school programs may take consolidated meal counts, which are just a total of the meals served, rather than doing it by children's names. Attendance records are another CACFP requirement. Attendance must capture the individual's first and last name. Just to be clear, this is attendance at the meal, not attendance at the enrichment program. Meal count should never be higher than attendance, so attendance records make a great edit check to ensure that you are not overclaiming meals and snacks. Build in an edit check when compiling meal counts and attendance for the claim. USDA likes to see 2 sets of eyes on all program paperwork to ensure accuracy whenever possible. Some districts are using their point of service keypad system as attendance, as it links to a child's name and a tick sheet similar to those ones used in summer for the meal count. All districts currently operating the program do it differently. Do what works for you and your school. Accountability is key. Districts cannot claim more meals than participants in attendance. This is something that needs to be discussed when partnering with outside organization. The district is responsible if numbers are not correct. This is the meal count form that I talked about earlier, and it's available on our website. It gives space for a participant to write their first and last name, a check mark for attendance, and a check mark for the meal. Again, all at-risk sites meet these requirements differently. Do what works best for your sites. Monitoring and 5-day reconciliations are required for institutions with more than one site. It ensures program integrity. This form is available on our website, but is also sent out annually to at-risk sites upon agreement approval or renewal. The district is required to review each site 3 times per year. 2 of the 3 visits must be unannounced. At least 1 announced visit must include a meal service observation, and new sites must be monitored within the first 4 weeks of operation. We provide monitoring forms for you, which outline everything you need to observe and record. Like I said earlier, 3 monitoring visits per agreement year. 2 visits must be unannounced. One unannounced visit must include meal service observation. Make sure to vary meal services observed. If you are serving suppers and evening snacks or on the weekends, make sure to observe those as well. Please make sure to complete the 5-day reconciliation form at each monitoring visit. If you start a new site, the site must be visited within the first 4 weeks of operation. 5-day reconciliation forms, their purpose is to reconcile meal counts to attendance. You perform one at every monitoring visit, and it helps to determine if meal counts are reasonable and highlights discrepancies in meal counts and attendance. It ensures that license capacity is also being followed. This process allows us to look at a week's worth of attendance and meal counts to make sure things look okay. This document is also available on our webpage. The at-risk site is required to collect racial and ethnic data once per agreement year. On May 17th, USDA released a memo regarding racial and ethnic data. The racial and ethnic data can no longer be collected by visual observation. The racial and ethnic data collection instructions we have provided in the past are no longer valid. Where racial and ethnic data is no longer required to be collected by visual observation, Maine Department of Education Child Nutrition will use the United States Census to collect race and ethnic data by zip code and compare this information to locations of open summer food service program sites and CACFP at-risk feeding sites. The data collected can be used to verify that program locations allow for equitable access. SFAs who collect meal benefit applications to determine eligibility may have already met the race and ethnic data collection requirement through self-reported race and ethnic questions provided on the applications. It should be noted that information collected on the back of the application is optional, and sponsors should not deny any application if this section is not completed. Thank you for your patience as we navigate this change and await more clear guidance from USDA. Districts complete and submit their claims for reimbursement to DoE monthly within the CNP web system. Make sure you keep monthly claim information on file along with supporting documentation. When filing a claim, it's important to remember that each claim applies to a single calendar month. Example is February 1st to February 28th, even if that month ends in the middle of the week. At-risk after-school programs receive the free rate of reimbursement for all meals and snacks served. These are the current reimbursement rates. Again, this presentation is being given in June and reimbursement rates are updated in July. If you have any questions about current rates, please contact the state agency. CIL stands for cash in lieu. This is extra money or extra reimbursement money that you will receive for every lunch and supper served that meets the meal pattern. So for every free lunch and supper you serve, you'll actually receive $3.75 in reimbursement. This is a screenshot of a site claim for a for-profit childcare center in our online claiming system. We've had a lot of folks tell us that they really like this new claiming system. This is the information you'll be entering each month for each of your sites. At-risk programs enter the number of kids that participated in the month in the free section, as they get the free rate of reimbursement for all their participants. Next, you'll enter the number of days you operated. That's the number of days that you were open for enrichment and fed kids at least one meal or snack through CACFP. Next, you'll enter your total monthly attendance, which I'll explain in the next slide, and then you'll enter your total meal counts for the month. There are a couple of more steps involved in submitting your claim for payment, but we have directions for filing claims in the new system and are here for assistance when you need it. As I mentioned, you will be required to report your total monthly attendance in our online claim filing system. This is how you calculate your total monthly attendance at the end of each day. You'll count the number of unique kids that attended your center. At the end of the month, you'll add up all of the daily totals to calculate your total monthly attendance. The payment system has edit checks in place to ensure that we are paying you based on what you are approved for in your agreement. If you try to claim more than what's in your approved agreement, the system will give you an error message and the system will not pay a claim that has errors. When you claim, you cannot claim for more kids than you've reported as being enrolled in your program. Since you are an open site, this is the best guess you made regarding the max amount of kids you could serve at one time. If your program has the potential to serve more kids than your best guess that you put in your agreement, say there is an event happening at your school during the same time as your CACFP at-risk supper time, make sure you increase the amount for the month you plan to serve those additional children. Also, you cannot claim for any meals or snacks that you're not approved to serve, and you can't claim for any months that you said you would be closed. That's why it's so important to make sure that the information in your agreement is always current and correct. Also, if you go in to update your agreement, the system also looks at your sanitation and fire inspection dates and will not allow me to approve the agreement if those dates have expired. We have been working around that process due to delays because of COVID, but please make sure your agreement is updated with any changes. Also, when you make any change to your agreement, such as you increase the number of kids enrolled, we need to approve that change before you'll be able to file a claim for that change in the system. I can pay you for the changes in a month that you report the change and going forward, but I cannot pay you for changes in the past. For example, let's say you revise your agreement on February 8th to increase your enrollment from 100 kids to 110 kids, and we approve the increase on February 9th. I can process your February claim for up to 110 kids, but I couldn't process your January claim or any month prior to February with 110 kids, only the 100 kids, because that's all that you were approved to serve in January and before. Claims must be entered into the system and must be in pending approval status on or before 60 days after the last day of the claim month. Example, November's claim must be submitted on or before January 29th. The system does display the claim due dates for you, so you'll always know when claims are due. Exceptions. Institutions are only allowed to be human once every 3 years. Submission of claims past the 60-day deadline are only allowed with prior approval from the state agency and require that you write a corrective action plan, which you will implement to prevent future late claims. Can the CACFP at-risk after-school program continue to operate in the summer of 2021 after schools close for summer vacation? For example, if a school officially ends school year 2020 through 2021 on May 30th, can the school continue to operate until June 30th? The answer is no. Experienced sponsors are already aware that under federal regulations, CACFP and SFSP cannot operate at the same time. Whenever your school year ends, so must CACFP. Schools are encouraged to transition into SFSP during the summer, and CACFP at risk can pick back up again when school starts in the fall. Now let's talk about the COVID-19 child nutrition waivers. There's quite a few. There's the non-congregate meal service waiver, the mealtime requirement waiver, a waiver to allow parents and guardians to pick up meals for children, a meal flexibility waiver, an area eligibility waiver for after-school programs, and there was an extension of the monitoring requirements for sponsors in CACFP. So CACFP, SFSP, NSLP, SSO, let's get some things straight. Unlike the previous school year waivers, the new set of waivers for school year 2021 issued on April 20th did not extend the option for schools or non-school sponsors to operate the summer food service program in school year 2021. When schools reopen for school year 2021, schools may choose to participate in SSO, which is the seamless summer option, or NSLP, National School Lunch Program, and the school breakfast program during the day. So what happens after the school day? If a school decides to continue operating NSLP or SBP, they can serve after-school snack through the after-school snack program under NSLP, bearing that they qualify for the program. Or they can apply for CACFP at risk after school and serve an additional meal and snack. If a school decides to operate SSO and serve breakfast and lunch during the school day, the school cannot serve an after-school snack unless they apply for CACFP at risk after school. If a school decides to operate CACFP at risk for snack and supper, the reimbursement rate would be the free rate under CACFP. It's important for schools to know that SSO cannot operate on weekends and holidays, but CACFP at risk can serve up to one meal and one snack per day at any time during the school year, as long as the required education and enrichment activity is met. Let's talk about the nationwide waiver on area eligibility. This waiver allows at-risk after-school care centers, regardless of their location, to apply to participate in the CACFP and claim all meals and snacks at the free rate of reimbursement. This waiver is effective July 1st, 2021 and remains in effect through June 30th, 2022. This waiver gives schools the opportunity to partner with outside organizations that already provide education or enrichment activities to kids after school. The school provides the meals and the outside organization provides the childcare and the activities. With these type of partnerships, since the outside organization is not a legal entity of the school, there are a few extra steps in the CACFP application process. Schools must be aware that they are the responsible party when operating the CACFP with an outside partner. Maine has several wonderful CACFP at-risk partnerships that supported each other successfully throughout the pandemic. Next, we're going to talk about three nationwide waivers. They indicate that they are available through June 30, 2022, but should only be used until greater levels of congregation in school settings is safe and healthy to pursue. So who determines when congregate meal service is safe and healthy to pursue? The local program operators should coordinate with the state agency to determine when congregate meal service is safe and healthy to pursue. FNS expects schools to use the meal service flexibility waivers listed on your screen only for the duration and extent that they are needed. Local program operators, in collaboration with the state agency, are best positioned to determine how and how long and to what extent these waivers are needed. For example, when all students at a school can safely return to the school cafeteria for breakfast and lunch, the school would no longer need the non-congregate meal service waiver. However, FNS understands that some schools will use alternative meal service models next school year and may need the flexibilities provided in these waivers in order to continue serving safe meals. In other cases, schools may be able to return to in-person meal service, but need the flexibility for certain students who continue with remote learning due to special health care needs. Local circumstances will differ and change over time, and FNS encourages schools to return to standard meal service operations when it's safe to do so. Next, let's talk about the meal pattern flexibilities. School requests to utilize the meal pattern flexibilities for CACFP will be made using an MS form on our webpage. When completing the form, the school will need to provide information about its meal distribution plan as justification to waive the milk variety and the grain requirements. The state agency will consider requests that are targeted, justified, and plans that support safe access to nutritious meals. Next, we're going to talk about the monitoring requirements. Under program regulations, CACFP sponsoring organizations must review each facility 3 times each year. At least 2 of the 3 must be unannounced. At least 1 unannounced review must include observation of the meal service, and at least 1 review must be made during each new facility's first 4 weeks of program operations, and not more than 6 months may elapse between reviews. However, FNS recognizes that in this public health emergency, suspending on-site monitoring is vital to supporting social distancing while providing meals. Additionally, with many CACFP facilities closed, monitoring CACFP may not be possible in some instances. FNS recognizes that sponsoring organizations, in this case, the CACFP at-risk schools, continue to need additional support and flexibility to monitor CACFP while managing the impacts of COVID-19. Therefore, FNS has extended its waiver of the requirement that CACFP monitoring requirements be conducted on site. The state agency has created specific monitoring forms for those utilizing the waiver. Please reach out to the CACFP team for more information. The nationwide on-site monitoring waivers 94, 95, and 96 remain in effect until 30 days after the end of the public health emergency. Is this based on federal declaration of a public health emergency or a state declaration of a public health emergency? The waivers providing off-site monitoring flexibilities nationwide are dependent on the federal public health emergency, which was declared by the U.S. Department of Health and Human Services on January 31st, 2020. For purposes of these waivers, the end of the public health emergency will be the date declared by the U.S. Department of Health and Human Services, and the waivers will expire nationwide 30 calendar days after that date. For more information on all the Child Nutrition Program waivers, please visit the link on your screen. Thank you for attending the training today. Don't hesitate to reach out to our office with any questions. New applicants and experienced sponsors should go back to the CACFP at-risk webpage and complete the At-Risk 101 quiz. This tracks your participation for this annual training. Due to this being a pre-recorded webinar, no certificates will be sent out. Please document your time and attendance after viewing this webinar and keep that documentation in your CACFP files. Thank you for watching, and I hope you have a wonderful day. Stay safe.